How I healed my trigger finger naturally. I want to start off by stating that I am not a medical professional. I am just an average person who has dealt with several instances of trigger finger in multiple fingers. I've had surgeries to correct the issue in the past, but after developing trigger finger so many times, I began to do research on trigger finger to see if I would be able to successfully heal my trigger finger without any medical procedure. The great news is, I was successful at healing my trigger finger. The information in this video should not be considered medical advice from a doctor or medical professional, but rather a resource to inform you how I was able to heal my trigger finger naturally. I know this video is long and has a lot of information in it. I wanted to make it as thorough as possible so the reader would have as much information as possible to help inform them. I first developed trigger finger when I was 18 years old. It started out as an annoyance, but later developed into an advanced case that caused severe pain and hindered me from doing normal activities. At the age of 20, I had my first trigger finger surgery on the middle finger of my right hand. When I turned 31, I began to experience some stiffness in the middle finger of my left hand. It quickly developed into a debilitating case of trigger finger. Every morning my finger would be locked in the bent position and was difficult and painful to unlock. My trigger finger prevented me from doing the things I needed to do each day, like tie my shoes or type on a keyboard. The pain was also extremely intense. Just so you understand, I didn't just have a mild case of trigger finger, it was very severe. At this point I knew I needed surgery because the impact it was having on my life was too much. When I called to schedule an appointment and determine the cost, I found out it would cost me $10,000 out of pocket because the cost of surgery would max out my insurance deductible. I wasn't comfortable spending that amount of money, so I began researching what I could do to heal my trigger finger naturally. Before I knew how to heal trigger finger, I needed to know exactly what it was. Trigger finger or trigger thumb, also known as stenosing tenosynovitis, is the locking or snapping of a finger when the hand is closed and opened. When you open and close your hand, tendons, which are attached to the bones of your finger, slide through a tendon sheath. The tendon sheath becomes inflamed and this interferes with the gliding motion of the tendon. One can sometimes feel the formation of a lump on the tendon when applying pressure to the base of the affected finger while opening and closing your finger. When I began researching causes for trigger finger, some of the best information I found came from Dr. John Ellis. If you have never heard of Dr. John Ellis, he was the author of the book, The Doctor That Looked at Hands. Originally, Dr. Ellis began working with patients suffering from coronary thrombosis. Many of these same patients were also suffering from hand, shoulder and elbow issues as well. While working with these patients, he restricted them to low-fat diets. The diet basically consisted of low-fat, lean meats and increased fruits and vegetables. While his work with diets was nothing out of the ordinary, what he discovered from it was his patients began recovering from their hand, shoulder and elbow ailments. One lady's recovery was absolutely remarkable. This particular lady's hands were so bad before the diet she could not even bend her fingers at all. They were stiff and had no flexibility. After being on the diet for several months, the lady could now move her fingers well enough to play the piano. Soon Dr. John Ellis began studying how this diet contributed to the healing of hands. Dr. Ellis suspected that a deficiency in vitamin B6 was the root cause of these hand issues. He began testing out the theory on patients suffering from hand issues like trigger finger, arthritis and carpal tunnel. One patient after another were seeing results from Dr. John Ellis' test. His hunch was right, a vitamin B6 deficiency directly affects the hands. It should also be noted that Dr. Ellis determined that many deficiencies were caused by high consumptions of fat. When a person's diet has a high amount of fat, the body cannot absorb enough vitamins and minerals needed, creating this deficiency. Dr. Ellis stated that in his 36 years of working with hands, every patient he prescribed vitamin B6 were cured of their trigger fingers. Oftentimes patients suffering from carpal tunnel and arthritis also found relief. Dr. Ellis suggested between 25 to 300 milligrams of vitamin B6 taken 3 times every day. The most common prescription was 50 milligrams taken 3 times a day. While this has been shown to be highly effective, it can take up to 6 months to see a full recovery. In Dr. Ellis' book, The Doctor Who Looked at Hands, he wrote, "I firmly believe that 90% of what is called arthritis in the United States is, in reality, a biochemical change in synovium, a specialized connective tissue that lines the inner surface of capsules of synovial, joints and tendon sheath, of tendons and joints, particularly in the fingers, thumbs, elbows, shoulders, knees and hips. With these changes in synovium, a person experiences swelling, pain and stiffness of the joints, symptoms that most men and women as well as doctors call arthritis. I have proved these conditions respond favorably to adequate amounts of pyridoxine, a colorless weakly basic solid present chiefly in cereals, liver oils, and yeast, and important in the metabolism of unsaturated fatty acids, given over a period of 90 days. Many of my patients experienced relief in only a matter of weeks, but in the majority of cases, it does take about 6 weeks for the symptoms to start disappearing, and 12 weeks for a definitive response. In cases of severe stiffness, there will be gradual improvement up to a year. Case Study 1. Joseph Deschamps was suffering with severe stiffness in all fingers on both his left and right hands, with 40% loss of flexion and extension. After receiving a vitamin B6 treatment, 200 to 500 mg daily for 12 weeks, the severe stiffness subsided remarkably in his fingers. His carpal tunnel syndrome also completely disappeared. Case Study 2. Sarah Black had extreme swelling in both of her hands and feet accompanying pregnancy. Sarah was also suffering with carpal tunnel syndrome. Both of Sarah's conditions responded spectacularly to vitamin B6 therapy. Sarah's husband, Gerald, also sought help from Dr. Ellis for his carpal tunnel syndrome. After 12 weeks of treatment with 100 mg of vitamin B6 daily, all swelling, numbness, tingling, and severe stiffness of his fingers subsided in both his left and right hands. Case Study 3. Jim is a 46-year-old retired New York policeman who uses power tools to repair his house. His problem is chronic pain at the base of the thumb and wrist. The pain worsens with use of the hand, making it difficult to use the power tools. Other repetitive motions cause pain such as turning a key in a lock, unscrewing the lid of a jar, and opening the car door. Jim also has trigger finger, involving the thumb joint, and at night before sleep he notices tingling and numbness in the hands. Jim's hand pain worsened lately, so he went to a hand surgeon who gave him a steroid injection at the base of the thumb and applied a hand-wrist splint. These measures were ineffective, and his pain continued. The surgeon offered an operation. Jim came into the office to ask if anything else could be done to avoid surgery. I first learned of B6 for carpal tunnel from reading Dr. Jonathan Wright's newsletters. Credit and thanks goes to Dr. Jonathan Wright. As it turns out, there is a simple and effective vitamin therapy for Jim's trigger finger hand condition called pyridoxine, vitamin B6. Jim was given a bottle of pyridoxal phosphate, the activated form, and 3 weeks later, an amazed Jim returned to report that his pain and swelling is gone, and his trigger finger had also resolved. He no longer needs the operation. Dr. Ellis suggested that aspirin or another form of non-steroidal anti-inflammatory drug was often used to inhibit pain during the first 90 days of a vitamin B6 treatment therapy. He also found that people with carpal tunnel syndrome and other hand ailments often have a large deficiency of vitamin B6, or have lifestyle factors that inhibit B6 metabolism such as stress, or ingesting yellow dye number 5 and tartrazine derivatives. In the book, The Doctor Who Studied Hands, Dr. John Ellis indicated in his 40 years of practicing medicine, he did not have one person who had not been healed when taking 150 mg of vitamin B6 a day for 6 months. When considering a vitamin B6 treatment therapy, it is very important to understand that taking large amounts of vitamin B6 can be toxic to a person. Usually the amount of vitamin B6 required to be toxic is between 2 to 5 grams per day, well above the amount suggested by Dr. Ellis. Because standard vitamin B6 has the potential to be toxic, many physicians recommend taking pyridoxal 5-phosphate, also known as P5P. P5P is the active form of vitamin B6, and even when taken in very large doses, it is considered non-toxic to the body. When vitamin B6 is ingested into the body, the liver has to convert it to pyridoxal 5-phosphate so the body can utilize it. The waste of this conversion is flushed out through the urine. This is how large quantities of standard B6 become toxic. The liver is not able to process it quickly enough and it builds up in the body. Additionally, some people's liver have a difficult time converting vitamin B6 to P5P, further leading to a deficiency. For this reason, P5P is the superior choice over standard vitamin B6 with treating trigger finger, carpal tunnel and arthritis. With the information I gathered from Dr. Ellis, I began to take a P5P supplement. The P5P supplement I chose was the Now brand P5P. I started taking these vitamins 3 times a day. I took the first pill in the morning before I went to work, around 6 a.m. I took the second pill when I got home from work, around 4 p.m. and I took the final pill before I went to bed, around 11 p.m. In total I took 150 milligrams of P5P every day for 6 months. During this time I did not encounter any harmful side effects. Within a couple of days after I started taking the P5P supplement, I could already tell a noticeable difference with my trigger finger. While my finger would still be locked in the morning, the pain had subsided quite a bit. Prior to taking the P5P, I would spend up to 20 minutes every morning trying to straighten out my finger and get it to the point I could use it. It would also ache throughout the day. After taking the P5P for a couple of weeks, I was able to straighten out my finger within a minute or two and with considerably less pain. Also, my finger barely ached at all during the day. It did take 5 months of taking the supplement in addition to resting the finger, which I will discuss in detail later, before I was completely healed. I took 150 milligrams of P5P for 6 months in total though because that's what Dr. Ellis had mentioned from his experience. Additional notes about my experience with P5P. I will note that around the 3rd month my trigger finger started to hurt more than usual for some reason. It did not hurt more than it did in the beginning before I started taking the supplement, just more than I was used to since I had started taking the P5P. I assumed maybe the supplement was no longer working, but I stuck with taking the P5P supplement. After about a week and a half it stopped hurting more than usual and continued to improve again with each day. It was the end of November and there had been a cold snap that could have led to the increased pain. I wanted to mention this, so if it happens to you, you shouldn't get discouraged. It happened to me too. Just know this may be a long process, but stick it out before assuming it doesn't work. After taking P5P for the initial 6 months, I stopped taking it completely. After all, my finger was 100% back to normal with no pain, no stiffness and no locking up. I experienced no issues with it at all until 10 months later when I strained my finger again by carrying a very heavy suitcase for a long period of time. After this my finger began to ache and lock up again, though it was not as painful as it had been before. At this point I had already met my insurance deductible from another incident, so I scheduled to have the trigger finger release surgery. My surgery was 2 months away and my finger was causing me issues, so I started taking P5P again. By the time my surgery date came, my finger was almost 100% healed. I went ahead and had the surgery though, so I would never have to worry about it again, but I was convinced that P5P did cure trigger finger. I would get to prove this once again. Several months after my second trigger finger surgery, I began to develop trigger finger in my index finger of my left hand. As soon as I noticed the stiffness and locking of my finger, I began taking P5P once again. Within 2 weeks, the stiffness and locking had disappeared. My advice to you is as soon as you begin to develop trigger finger, start taking P5P right away. This will reduce the duration it will take to heal it. Ongoing P5P therapy to keep trigger finger from returning. After healing my second finger, and third instance of trigger finger, it was obvious that I would need to continue taking P5P regularly to keep it from coming back. I began to experiment by taking only 50 milligrams of P5P a day. I did this for several months and no symptoms were ever noticed. I can't tell you the exact minimal amount of P5P needed to keep trigger finger from coming back once you've completed the initial 6 months of P5P therapy. Everybody is different in this regard, so you will need to experiment to find out what works best for you. I recommend to start off just taking 50 milligrams of P5P each day. Take magnesium with P5P. The brand of P5P that I took included magnesium within the pill, and this is often the case with most P5P supplements. However, not all P5P supplement include magnesium, so be sure to check. The P5P supplement actually helps to increase the amount of magnesium a cell can absorb. Magnesium has been shown to help repair tendon damage, which causes trigger finger. So when the two are used together, this helps the tendon recover from the micro tears that causes the nodule that causes the finger to get stuck in the locked position. Once healing has taken place, the tendon should again slide smoothly through the tendon sheath without pain or locking. For reference, I took 300 mg of magnesium each day in addition to the 150 mg of P5P I took during the 6-month P5P therapy. Resting your trigger finger. In addition to taking a P5P supplement, many resources indicted that resting your trigger finger can help reduce inflammation. I chose to wear a metal finger splint that is commonly worn for broken fingers during the night when I slept. Initially, I did not wear any type of splint during the day as it interfered with my work. I found this to be very helpful. Before wearing the splint, my finger would be locked in the bent position each morning. Working it free from this position was very painful and would sometimes take 20 minutes to work it free. Once I began wearing the splint, upon removing it in the morning, my finger would be stuck in the straight position. However, I discovered that working it free from that locked position was much less painful and only took 30 seconds or so to get it moving freely again. I wore this metal splint each night for 4 months. One night around the 4-month period, the splint had come off during the night. When I woke up, I noticed that my finger was not locked in any position and was moving freely without any pain. From that day forward, I stopped wearing a splint. I believe that I did not need to wear the splint for as long as I did. I think some of the stiffness I was experiencing towards the end was due to the splint itself. Wearing a splint that prohibits mobility for too long can actually cause issues with arthritis. Note, I did not suffer any issues with arthritis, I just wanted the reader to be aware. The best method for resting your trigger finger. I have since discovered a superior method for resting your trigger finger, which is what I recommend to everyone now. This method allows the finger to move some, but also keeps the finger from moving so much that it causes pain or locking of the finger. I call it the Band-Aid brace. It works for fingers and the thumb. Best of all, it's very easy to create yourself. All you need to make one is 3 regular-sized Band-Aids. The first Band-Aid goes along the top on the finger or thumb with the pad of the Band-Aid resting on the knuckle. The next Band-Aid goes around the base of the knuckle. The final Band-Aid goes around the top of the knuckle. This should allow you to move your finger slightly, which prevents the finger from getting too stiff from immobilization, while also preventing the finger from moving too much that it is able to get in the locked position. With the Band-Aid brace, you can wear it both day and night. I used this method when I started to develop trigger finger in my index finger and found it to be a much better solution compared to the metal splint I wore originally. I felt like my finger healed much faster when I allowed slight movement instead of total immobilization and wore it all day instead of just at night. The only downside is you will go through a lot of Band-Aids and you will want to remove the Band-Aid for brief periods of time to allow your skin to dry out and breath. Soak your trigger finger in hot water. This is recommended. During the beginning of my 6-month therapy, I found it very helpful to soak my hand in hot water. I would start by placing the hand in a bowl of hot water with my fingers fully extended. After 10 minutes I would begin to slowly make a fist, then straighten out my fingers. This really helped to reduce the pain I experienced during the evening from my trigger finger. I found adding Epsom salt to the water from time to time helpful as well. I did not do this for the entire 6 months, though you are more than welcome to if you find it helpful, but I did do it for the first month. After the first month, my trigger finger had improved enough that I didn't find it necessary to do it every day. Massage the nodule on the tendon. This is recommended. In my research, I came across a couple of articles talking about how doctors in the olden days would take large books and drop them on the hand to try and smash the nodule on the tendon, attempting to break it up. While that did not seem very effective, or safe, I thought maybe if I rubbed the nodule periodically, with a decent amount of pressure, it would help to break the nodule down some. At the base of your trigger finger on your palm, you will likely feel a hard lump on the tendon that runs up your finger. It's especially noticeable when you open and close your fist while pressing on this area. A couple times a week I found it useful to rub the nodule with a fair amount of pressure. This can make the spot quite sore, and once it begins to get pretty tender, it's probably time to stop. Another method that worked quite well was placing a hard rubber ball or some type of cylinder-shaped object, like a pipe, on a solid surface. Next, you place your hand on top of the ball or cylinder, with the nodule area being the spot that presses against the ball or cylinder. Slowly roll the ball or cylinder with the part of your hand where the nodule is located. You should feel the pressure from the ball or cylinder causing some soreness to the nodule area. Doing this can help to break the nodule down and reduce its size, which is what causes the finger to lock up. After applying pressure to the nodule area, apply a cold compress to the area to help further reduce inflammation. Take aspirin in the beginning of treatment. Per Dr. Ellis notes, he stated that taking aspirin during the first 90 days of treatment was beneficial for managing pain and inflammation. I however did not take aspirin when I successfully healed my trigger finger, but you may find this helpful. Avoid yellow dye number 5 and tartrazine derivatives. Yellow dye number 5 and tartrazine inhibit B6 metabolism, which leads to the deficiency that can cause trigger finger. Yellow dye number 5 can be found in soft drinks, certain beverages, baked goods, breakfast cereals, processed vegetables, chips, pickles, honey, mustard, gelatin desserts, pudding, ready-to-use frostings, dessert powders, candy, gums, cosmetics, and in certain medicines and other foods. I personally did not pay attention to labels to avoid these items specifically when I healed my trigger finger. Change your diet. A diet that consists of low-fat, lean meats and increased fruits and vegetables was shown by Dr. Ellis to improve symptoms of trigger finger, carpal tunnel and arthritis as well as issues with the elbows and shoulders. Also make sure you are drinking enough water and are adequately hydrated. I didn't specifically change my diet when I healed my trigger finger, but I did work on drinking more water each day. Some final thoughts. I have offered this advice to people I know in real life who told me it has worked for them. I have also shared it to anyone who finds this information on the internet since 2018, and since that time I have heard from a great number who were able to heal their trigger fingers and trigger thumbs as well. While I want to state again that I am not a medical professional, I am just a regular person who researched and experimented until I figured out what worked for me. I did receive this message from a medical professional, which I do think is worth sharing. As a physical therapist, I have to say I am impressed with your treatment plan. Unlike most in my profession, I am open-minded and realize that every body is different and does not respond to the same protocol of treatment. I give you a thumbs up, and additionally am going to say that what you have explained is the exact treatment that should be initiated for trigger finger. Repetitive motion is the cause, along with hereditary predisposition, for many joint pathologies, as you already know. My knowledge of B6 tells me that it is very beneficial to joint rehab in general, as in mega doses can work wonders. Magnesium is a natural muscle relaxer and the combination is appropriate. Heat therapy is known to be successful, as many patients report relief of symptoms post-hot whirlpool therapy. The root of the problem is repetitive motion at the MCP joint knuckle. Using the Band-Aid complex at all times is an affordable method of reducing tendon movement through the affected joint, which causes inflammation and pain. Wearing an uncomfortable splint is difficult to adjust to and disturbs needed sleep for some. The Band-Aids, as you utilized, provide for some movement, but not enough to disturb the exacerbation created by the continual movement of the tendon sheath within the MCP joint. This is a great idea and an excellent demo and testimony. It makes perfect sense and addresses the initial cause of the trigger finger dilemma. One final thing I would like to mention that alludes to the comment above. I have also heard from dozens of people who said they told their doctors about my treatment plan and were laughed at, saying it would never work, surgery or a cortisone shot was their only options. They followed my plan anyways and were completely healed. I hope this information was useful, and most of all I hope it helped you with your trigger finger or thumb.